Excellent. Congratulations for even making it this far. We've almost finished part 2 of the Resolve Back Pain book. Okay, you have been learning so much, and I really do help. A couple little things along the way have been helping you understand what's been affecting and influencing your pain experience. So let's continue, because today we're talking about 2 things. One is why scans can actually hurt and hinder our pain experience and how anxiety plays a part in it. Now, if you've been watching all the videos, we might have talked about anxiety already and how anxiety isn't a bad thing. It's something that can light a fire underneath us and help us get things done. And we're going to talk a little bit more about that today, because there's a really good book that helps us understand why stress isn't the bad guy. Okay? So before we move on to that aspect, I do want you to turn to page 37 in your book, if you've got the book. This is the page that talks about why scans hinder our progress. Okay? They can help. If we're looking at how we can use the scan to get better, to maybe look for red flags, totally helps. But here's the thing. When we look at a scan of our back, and if I was to go and take 100 people who were pain-free, asymptomatic, off the street, varying in age, okay? And in the book, it talks about the different varying in ages in the 30-year-old group, the 80 or the 50-year-old group, and the 70-year-old group. If we take 100 of those people off the street and we give them a scan, if we look for disc degeneration, okay, you're going to find that in the 30-year-old group, no pain, 52% of those 100 people, so 52 of them, will show they have some type of disc degeneration, okay? We look at the 50-year-old group, that would be my group, okay? We're looking at 80% of people having disc degeneration. And when we get into the 70-year-old group, it's a 93 percentile. So there's a great physical therapist out of Ontario named Greg Lehman, and he's got an awesome video that talks about how these results and how when we get our scans, even if we have pain, we need to be able to look at the results as wrinkles on the inside, okay? They don't necessarily cause pain, but there's something that might be contributing, all right? So when we look at other aspects like disc bulge, a herniated disc, okay? We're looking at the bulges to herniations, slightly different, but at the same time in the 30-year-old group, 30-year-old to 40-year-old, there's 40% of those scanned who have no pain that are going to show a disc bulge, okay? Same thing with spine arthritis. When we talk about arthritis, we get such a picture in our mind. And when I got my results, I was, I believe, 39 when I got the results of my X-ray, okay, that explained a couple things. My MRI, in theory, showed more pictures, but my X-ray talked about my severe disc degeneration in certain areas, and it talked about having arthritis in my facet joints. The second that I heard those words, and this is why sometimes when we are over scanning, okay, and we're getting imaging done on every little ache and pain, this specifically is what happens. I heard those words, facet arthritis, and I went, yes, that's the pain I'm feeling. My mind even went right into my back, into that same spot. I moved a little bit and went, oh, that's it. Now I had a connection. That makes for a stronger nervous system pathway to that location. And anytime that kicks up, you're gonna be like, oh. Now, there's a way to look at this and go, okay, I have some arthritis in my spine. That's a wrinkle on the inside. How many people have it? By the time you reach the age of 50, 32% of people have it who don't have pain. That doesn't say the whole population. That's the percentage of people who don't have pain that show that on an MRI or an X-ray. When we're looking at the 70-year-old group, it goes up to 69%. So again, this is a kind of wrinkle on the inside that may or may not produce pain, but what does produce pain? And I worked with one client in particular who was told she has arthritis in her spine, do not twist. She was told by a physiotherapist, do not twist. Now, this was a very active woman, okay? She loved being in the outdoors. She loved moving her body. She loved doing physical things. And all of a sudden, she's told not to twist. I want you to just imagine trying to go through your day where there's a fear, and you may even have this, you may have personal experience with this, having that fear of making things worse if you twist, right? Now, we twist a lot throughout our day. Now, you're going to find as we go through our movement videos that that's one movement we're going to slowly be building up on. Twisting of the spine, flexion of the spine, extension, sitting up tall of the spine, and laterally bending are movements of the spine. And with a result from our scan, our mind can now picture and put something in a spot, plus on top of that, a physiotherapist, a doctor, a chiropractor, an acupuncturist, a naturopath, an osteopath, a massage therapist. All of these people may have said something in your past saying, don't do this, don't do that, don't do this, right? When you go to arthritis information sessions that are run by the Canadian Arthritis Society, they are still talking about how you're not supposed to move your spine. There is significant research that shows when you move your body, you get nutrients into those joints. Your joints stay healthier. So think about how that process works. Your back hurts, you go to the doctor. Eventually, your doctor will probably send you for x-rays sooner or later. Your doctor reads that you have disc degeneration or arthritis in your spine. Oh yeah, oh, arthritis. Yeah, you know what? You should go to an arthritis information session. Now all of a sudden you're being told not to move your spine, or the doctor's probably already told you that too. Don't bend over, don't pick up things, don't do this, don't do that. Next thing you know, you're like, oh, I need to keep my spine perfectly neutral, perfectly stable. I need to have a strong core. Now we're building tension. The more we build tension, the more we restrict movement in our spine. The more we build tension, the more we build compression in our spine. I hope you can see where that's going, because I really don't want to talk you through any more of that negative pathway. So when we look at our scans, we need to be able to look at them and go, yeah, well, that's kind of a normal aging process. How much of that truly actually affects the pain experience that I'm having? And how much of what a doctor said, or physiotherapist has said, or chiropractor has said affects that view of what's going on in my back? This is how, when we have imaging, and there is a study out there, and I wish I could remember the exact numbers, but it talks about how when you have imaging and there's no red flags for back pain, it actually sets you up, I think it's around 60 to 70% more likelihood that you're going to end up with chronic pain versus if you didn't get that scan. Those are huge numbers, but this is the way our medical system is used to treating biomedical aspects and just treating a structure, not the whole person. So again, just like we started at the beginning of this class, pat yourself on the back. You are here. You are learning. It's not going to switch overnight. There's certain things that might, right? I talked about how my experience, that idea that if I was going through a stressful time, we're going to talk about stress in a moment. If I was going through that stressful time, I was able to just in my brain take a moment and say, this isn't tissue damaging. This is this. This isn't tissue damaging. This is this. And it really helped to change that pain experience, because now my nervous system would go, right. She didn't fall down a set of stairs. She didn't get into a car accident. She didn't do something she shouldn't have, and now she's overloaded the system. This is completely not tissue damage. So we don't need to send a pain signal. She's recognizing that this isn't a great situation she's in. So now I can mentally start preparing for that as well. Okay? Now, with that, I want you to just, the bottom of the page, there's a great image that shows two lines of people. Okay? The top line of people is people who are like, on this side, no, I don't have any pain. And on this side, I have debilitating pain. All right? And then they do the imaging. They take all the images and start rearranging the people into a line of, this person doesn't have anything going on in their spine, image-wise, structurally-wise, and then this person on the end has debilitating structure imaging. Now, there's a good chance that the person in the front here who has no pain is not going to go all the way over here, but they're going to fall somewhere in the middle. The person that's over here with debilitating pain might fall anywhere within that spectrum. They might even be beside the person who didn't even have pain, but their scan is very similar to the person who had the debilitating pain. So we have to be able to just put this in our mind that the scan, what shows on a picture structurally, is not specifically related to pain. Okay? So within that big picture of what's going on, I want you to start being able to take that step back and go, well, that's what my scan said, but I'm going to start working at this level, and I'm going to start building things up, and I'm going to start creating healthier patterns. Because that's all it is. And it's not just healthy movement patterns, it's those healthy thought patterns too. Catch yourself. And this is the practice of it, right? Everything takes practice. As much as you watch these videos and you start learning these things, this still takes practice. Even if it's just once a day that you can look and go, oh, my back is starting to hurt. What happened? Oh yeah, I was stuck in traffic. Is it because I was sitting? Is it because I didn't like being stuck in traffic? Is it because I was in a rush? Is it because I have lots to do later? Is it because it made me late for something? And just start processing it like that. All right? So now, getting to the end of our part 2. All right? We've got a clapperboard. You've got some homework. Now, this isn't homework that you're necessarily going to do right now, but you're going to do this after, because I want you to go back to that picture, the new view of pain. All right? You know, the one with all the lines. And I want you to find the doctor, the X-ray, the physio, the surgeon, and follow where those lines go. You're going to notice that when you follow those lines, they go to that little box, that protectometer. We're going to be talking about the protectometer in a lot more specificity soon. But you'll notice that those lines go into knowledge and beliefs. So if you think back to what we just talked about, I want you to pause the video right now and just write down 3 beliefs, 3 things that popped into your head that you've either heard from a doctor, heard from a physio, heard from a surgeon, seen on your X-ray, that you've gone, yes, exactly, no, that's really bad. Now, letting go of the fact that if it might be influencing your pain or not, I want you to write 3 things down. Those things that you've heard that keep popping up in your head. All right? So hit pause, write those 3 things down. Excellent. Welcome back. All right, now we were talking about that protectometer, okay? How the X-ray, the surgeon, the doctor, they all go into that knowledge and belief aspect of the protectometer. Now, when we look at that protectometer, if our knowledge and our beliefs are really strong, that the X-ray is that structural thing is the thing, and that no, I should never bend over, and no, I should never do this, that's gonna create more of a pain experience because your protectometer is going up. And again, like I said, we're gonna talk about that protectometer in a minute. However, before we finish off, as much as we talked about disc degeneration, disc bulges, and arthritis, there's another phrase out there that is very common, and that's slipped discs. Now, when we talk about slipped discs, I want you to understand this spine here, and we've talked about this once already. This spine is not your back. This model, and the way we can even view X-rays and MRIs, we don't really get the best picture of how our spine is a much more stable unit. And we talked about this already. Your spine is a much more stable unit and more effective than we give it even credit for. Okay, so when you hear the term a slipped disc, we think that something's going to slip right out. It's going to affect our spine or our nervous system, our nerves that run down our back. And yes, our spine doesn't always stay in perfect place, but I need you to understand, slipped disc, that specific terminology was brought about by the medical system to try and explain something, but it has taken on such a negative connotation, all right? When we look at slipped discs, these things do not slip. They do not come out. When I've talked about this, how the disc material, the cells that make up these discs, okay, and the vertebra, they are so intertwined that even surgeons have a hard time telling and noticing where they end and where they begin. Okay, so you could imagine this is actually one unit of different ways, different tissue material for it to be allowed to move. Okay, and like I mentioned before, there's 4 movements of the spine. If this is our spine, we've got flexion. We're pretty good at that, right? Slouching, all right? Not a horrible thing if you're doing it consciously, under load, and with awareness, which is consciously, okay? Unconsciously, gravity-driven slouching, not paying attention, not the best thing to do. We've got extension. Now, don't freak out here. Extension is what we would typically see as a back bend. Now, none of us are going to get crazy with back bends, but extension of the spine, even if you just reach your arm up, that helps create an extension of your spine, which is a nice movement. We've got rotation. Okay, we talked about rotation. Now we're going to talk about this more in the movement classes, but remember, rotation moves all the way up through your spine. It is not just a twist in your waist. We've also got lateral movement. Okay, lateral movement is dipping from one side and dipping to the other side. And sometimes that's a really hard thing to do because we're not used to moving our spine. But spinal movement is good for you. Okay, now remember, it's not forcing it. Oh, it's going to fall. Okay, it's just playing with it. Now, with that, we're going to go on to this drug cabinet in our brain. And we talked about the hormone musketeer earlier and how different hormones affect our body. We're going to be talking about this a little bit more in a second because some of those hormones are stress hormones that we've come to see as very negative things, and we should never, ever, hopefully get stressed in our entire lives because it creates heart attacks. We're going to talk about that in a second. But within the drug cabinet of our brain, some of those hormones, like oxytocin, can be happy hormones, okay? And those happy hormones can help you feel better. They can help encourage you to do things. There's a good chance each time you finish watching one of these videos, you get a dose of happy hormones because you've completed something, especially because you pat yourself on the back going, yes, I did it. I learned, even if it's just one thing. I wrote down something. I'm filling out my notebook. I'm learning. I'm paying attention. That's when we start getting those happy hormones, and those can greatly reduce our pain. With that, do know the prescriptions, okay, that doctors give us for pain, the majority of those prescriptions were specifically for acute pain. Remember, acute pain is a temporary thing. Chronic pain is a different thing. So they're finding that a lot of the prescriptions that are being used for acute pain and prescribed for chronic pain, when we get to the chronic pain aspect, they don't work as well, right? Then we start seeing how, like with opioids, the doctor goes, oh, well, I read research that now I'm allowed to up your opioid dose, right? And of course, what ends up happening is we end up getting this addiction process. Now, that's an extreme example. But when we look at prescription drugs, yes, some of them are good. If they work, they work. But do note, there is a drug cabinet in your brain, and it doesn't happen by sitting around. It happens mostly because of a little bit of movement, because a little bit of positivity, a little bit of a mindset shift. All right, we're going to talk about mindset right away here. So just finishing off part 2. There's a little section in the back of the book. I want you to fill it out. All right. Now, if you don't have the book, okay, there's going to be a tiny little list of questions in the workbook. I want you to fill those out as well. All right. Either way, read your part 2 notes. I want you to just scroll through them, just flip through each page, look at words that pop out, and if you can, write down 3 things right now that you've learned. Okay, clapperboard moment. You're going to push pause. Write down 3 things that you've learned in all of part 2, whether it's the musketeers, the new pain imaging, the mountains that we talked about. Write down 3 things right now. Excellent. Welcome back. All right, now I'm just going to put the Resolve book away for a second. I want to show you this book. It's called The Upside of Stress by Kelly McGonigal. Hopefully by now, there's a TED Talk you've watched, that there's a TED Talk attached to your workbook. That TED Talk is by Kelly McGonigal. And if you watched it, you know what I'm going to talk about. I want you to understand that stress, that anxiety, that those feelings of maybe even fight or flight, excitement, those aren't all detrimental. Now, I've talked about how when we have that constant fight or flight stress in our body, our cortisol levels go up. Yes, that's not a great thing. That chronic level of having that fight or flight response, that's not a great thing. We're working on that right now. But when you're working on that and you start managing it, every so often you're going to notice, I'm stressed. Oh no, this isn't good. Now I want you to flip the switch. When you are managing those chronic levels, if you get stressed, because you will, stress is a part of life, I want you to see it as a good thing. I want you to see it as something that's giving you energy to get something done. All right? So whether you have overloaded your schedule for the day, that overload stress is going to help you have the energy and get that done for the day, right? This part of stress isn't something that's the chronic level. It isn't something that we're doing every single day, waking up going, oh, I have to do this, I have to do that, I have to do this. This is going to happen, this is going to happen, this is going to happen. We started to pay attention to this part. I want you now, when you do get stressed, whether it's every second day or a few times a week, I want you to be able to flip that switch. This is your mindset switch that goes, oh, this is the good stress. This is the stress that's going to help me get things done. And I'm going to embrace it. And I'm just going to keep going. Don't do it every day. All right? I don't want you doing this every day. These are things that are like every so often, where you have a schedule that's full, where you have a work deadline, where you have a conflict that needs to be resolved, where you have something that just creates that level of stress, even if it's a presentation at work, at school, anything. Okay? Those are the random points where stress is good for us. All right? When we've got the chronic, daily, pushing through stress, that's not the good part. That's the part we're trying to work on. But I want you, now that you've been hopefully recognizing some of what's going on here, I want you to flip that mindset. I want you to see, this is good. I'm going to get through this. I've got the energy. Now we're done. Boom. Okay? Not an easy thing to do, but this is a really, really great book to read if you do have a little more time. I totally understand, not the easiest thing to do, but we're going to be taking a few more items out of this book as we go along. They're in your workbook. Don't worry about getting the book and reading it right now or ever. We'll still be talking about it. You'll get stuff out of it. So with that being said, this is the end of part 2. We're going to be moving on to part 3. So I will see you in the next video.